Have you been diagnosed with unexplained infertility? That frustrating place where, on paper, everything looks fine, things should have worked, and there is no obvious reason why you're not already pregnant. But what if your unexplained infertility hasn't been explored in as much depth as it could be? In today's episode, we speak with fertility naturopath Kathryn Moloney, who will show you that actually there is a lot more to the story. Welcome to your journey to fertility. This is the podcast that blends both science with spirit to give you all the tools you need as you navigate your fertility journey. I'm your host, Jennifer Edmonds, and for the last 15 years, I've been helping women on their journeys to motherhood and beyond. I believe that combining the latest scientific research along with the best energetic and mindset practices will help you to avoid putting your life on hold and bring you closer to your baby. Here each week, you'll learn ways to support your fertility and trust your body so you can stop stressing that you'll never have a baby and finally walk your path to motherhood. This is the Your Journey to Fertility podcast. Welcome back to the podcast. Today we are speaking with my good friend, Kathryn Moloney, who is a fertility naturopath. For the last 2 decades, Kathryn has been helping women and couples around the world to achieve healthy pregnancies using functional medicine to identify and address the underlying causes of their fertility challenges. She's also the mother to a 7-year-old after a very long fertility journey of her own. So she understands uniquely the fears and the challenges that come along with this journey. I have worked with a lot of naturopaths over the years in my own journey of trying to conceive and in a professional capacity with my students as well. Kathryn is the real deal. She continues to impress me in so many ways. She's relentless. I think that's the thing that strikes me most about her. In her mind, there is no such thing as unexplained infertility, and she will leave no stone unturned to help her patients get to the family and the pregnancy of their dreams. Now, she's also running a free workshop this week called Why Am I Not Pregnant Yet? And she's going to help people go through what are some of these underlying causes of their so-called unexplained infertility. It's a wonderful workshop that I've already had the pleasure of sitting in on in the past. She takes you through a guided workbook to help you uncover perhaps some of these little red flags that have been missed already on your journey. And it's an incredible way for you to go a little bit deeper and to find out perhaps what else could be going on. So she's going to talk about that towards the end of the episode. So make sure you listen right through until then. Let's get started. Here's Kathryn. Kathryn, I'm so excited to have you on the podcast today. We've actually done so much work together already. You have come into my beautiful membership group with my students to share all of your knowledge in many different ways. But this is the first time that I brought you onto the podcast. And so thank you. I'm really excited to welcome you today. Can we start by learning a little bit about you and what is your mission in the fertility space?
Good question, Jen. Thank you. Thanks for having me. My mission is to help people uncover the underlying cause in their fertility issues. So this is such a big passion of mine. You know, when I first started out after I finished studying, 20 years ago, I was treating fertility and, the way that we were taught at uni and, these are the herbs for fertility and this is that. And, I just didn't get the outcomes that I really wanted to for my patients. So, I have really gone on a journey of working out what the underlying causes are of fertility and then helping people to find out what those are for themselves.
Fantastic. And for those who are listening who may not be too aware, can you explain what the difference is between a naturopath and other functional health practitioners such as nutritionists or homeopaths or functional medicine doctors?
Great question. So naturopaths, I sort of feel like we're kind of the umbrella. We kind of do it all. And, we do nutrition just as nutritionists do. We are not doctors. We are naturopaths. It's a 4 or 5 year degree, so it's incredibly extensive. And I think the studying of naturopathy is, it's really good to identify that we study nutrition. We studied, the pathophysiology and the biochemistry and the anatomy and the physiology. And then we also putting the nutrition and the herbal medicine in. It's a massive, massive degree. And so we also do homeopathy. Some naturopaths do it more than others. Some don't do it at all. I'm kind of almost don't do any at all because it's not my preferred method of treatment. And then there are also straight homeopaths who are not naturopaths. They are just homeopaths. Functional doctors are people, or integrative doctors they're trained in a medical degree and they are a doctor. And then they go sort of more towards the naturopathic side, and they look at more the functional medicine in terms of, more extensive testing. I would say they don't so much use herbal medicine, but I could be wrong there. More sort of nutritionals, I would say. So yeah, I have a lot of patients who have worked, particularly in the US, who've worked with integrative doctors, and they get really great. I love them. They're fantastic, and they do all the testing and they're excellent. And sometimes they get to a point with them and they're like, well, I don't know if we're going to go any further, because a lot of the time they're not trained specifically in fertility, or they don't have specific experience in fertility. So I often have people come to me from the US who've worked with integrative doctors, and they're like, well, I've done all this testing. I'm still not pregnant. I think I need someone who's more fertility specific.
Thank you. And when you do hone in on one particular area, I find that you really do uncover. It's like being a GP, right? It's, you're a jack of all trades. So being a naturopath that really hones in on fertility really gives you some unique skills. So
yeah, I love specializing. And it's the same for everybody. When I started out, I was like a GP, a naturopath GP, and, you can do everything quite well. There takes a lot of research after every patient to make sure you're doing the right thing and that sort of thing. Whereas now when I specialize, all of the training I do, all of the personal development, all of professional development, all of the seminars, they're all focused on women's health and fertility. So it's just, I get to upskill in this one excellent particular area.
Yeah, wonderful. And so what made you go down the fertility path?
Yeah, so I would say the first thing that really jumped out at me was learning about fertility awareness. So understanding women's bodies, really. When do they ovulate? What are the signs of ovulation? How do women feel around ovulation? How do we know that the period is coming? I really loved, I was in my early 20s, and I really loved the idea of natural contraception. So that's probably also where my interest lay, because it's like so many women were on the pill, or they were getting pregnant accidentally. It's like, wow, women just actually don't know about our bodies. I didn't know when I ovulated. I was 25 and I didn't know when I ovulated. So, doing that course was incredibly empowering, like in a way that I could never imagine how empowering that was, to know my body and my fertility so well. And then from there, I really developed a love for supporting fertility patients. Helping people with natural contraception also gives you insight on how to treat people with natural conception. So that was a lovely, easy gateway into that. And then in around 2010, I started working in a natural fertility clinic, which was right next to an IVF clinic. So I started working a lot with IVF. That was a huge learning curve. I did a bit of work with IVF before that, but it was incredible to have such an incredible professional development in such a short time, working with so many IVF patients and so much complexity that, it really set me up really well to move further into treating all complex areas of fertility.
So you must see this, and I see this so often with the students that I work with, that they don't really have a huge fertility red flag. They've been through the testing with their doctors, and they've come back and they've been told, in inverted commas, your labs are normal, or they've got perhaps suboptimal fertility, but it's not the end of the world. Maybe their partners are on the sort of the lower end of normal. But they all kind of get lumped into this category of unexplained infertility, where on paper things should have worked, but they haven't. And this is an incredibly frustrating place to be in. I had all sorts of fertility problems. So I can't imagine how frustrating it must be to go through all of this and not even know why things aren't working. So it's a really, really hard place for people to be. So when someone is diagnosed with unexplained infertility, what investigations have usually been done at this point?
Often not a lot. to be honest. I would say this diagnosis of unexplained infertility, which to me is not actually a diagnosis. For me, unexplained infertility is actually unexplored infertility. It's a huge distinction because I've never, ever, ever come across a patient who has unexplained infertility who has had all the investigations and their fertility has been explored. It has never happened. And I still wait for it to happen, but it has not. So often I would say people get labeled with this undiagnosis after IVF, after failed IVF. So they might have, tried to conceive for 6 months, a year, 2 years, 3 years, however long, and depending on how old they are often. Then they go to do IVF and that is not successful. And then they say, well, we don't know why. So, you have unexplained infertility. Or they will have gone to the doctor, the doctor's looked at their results and they say, well, there's nothing I can see here. I, think it's unexplained. So go and see an IVF doctor. And, the distinction I make a lot when I'm talking about fertility is that IVF doctors are not fertility specialists. They are specialists in IVF. So I think what is the missing link here is that people go to their doctors, they get sent to an IVF clinic, and then they're doing IVF. So for me, there's a really big step, and this is one that I think I feel. Unfortunately, people end up coming to me after they've done IVF, which I wish and I hope, and, hopefully that people find me and people like me before they go to IVF. So then we can actually do all the testing that the doctors don't do and can't interpret. And so that we can really look at the underlying factors of their fertility issues, trying to find out a reason. And then, of course, if they need IVF, then they go and do IVF, but their chances of IVF being successful are much higher because we've looked at or ruled out any underlying issues. We've improved egg quality, we've improved sperm quality so that the chances of IVF are higher. So, so in answer to your question, what has been tested when they have this diagnosis? It's dependent, I think, on, I saw a woman yesterday, she's in Spain, and I've never seen so many tests been done and sent to me, and she hasn't done IVF. And I said, how did you have all these tests done? And she said, I pushed for them. So, she really did the research and she, looked at all of the factors and she pushed her fertility specialists to do these tests, and they were all really willing, which is also unusual. So that's one end of the spectrum. The other end of the spectrum is that they've had almost nothing done, and even the semen analysis has been done. It might have also been done at a regular lab. So you cannot trust the results of the semen analysis at a regular lab. They are not accurate. We have seen on literally 2 days apart a regular lab semen analysis and the mandrology lab semen analysis, and they are totally different. So, somebody, that male might have been to a regular lab, had their semen tested, and it's come back, oh, it's all quite normal. Oh, maybe your motility is a bit low. Or they have been at a fertility clinic that's actually an andrology lab. They are actually accurate, but the interpretation of that is not correct. So it might be that, exactly as I said before, oh, it's fine, except you've got a bit low motility. Well, that low motility might be the difference between you conceiving or not. And they're lumped with unexplained infertility. But the sperm health is problematic. Mm-hmm. It's just such a common situation that this happens. So, a lot of the time it is honestly a problem with the sperm health, and it has not been identified. It has not been treated. And this poor woman is then left with, well, I've got unexplained infertility. There's nothing wrong with my guy. And therefore, something wrong with me. I am broken, every month she's getting her period and feeling like she's failing, when actually there haven't been the investigations done or not interpreted correctly.
Oh, gosh, there's so much I want to pull out from everything you said there. The first thing that really struck me was that IVF doctors are not fertility specialists. And when you first said that, I was like, well, that's a bold statement. But no, actually, you're right. They're not trained in how to help your body become optimal to conceive on its own. They are specialists in using either the medications or the drugs or the surgeries that they have at their disposal to make your body become pregnant. And that is a huge distinction, I find. You're absolutely right, because that is their ultimate goal, is, of course, to get you pregnant, but they're not actually doing things to help your body improve its fertility on its own. That's, I found that.
And I mean that with absolute no disrespect. Imagine the amount of training they have done. Imagine that IVF even exists. Like, it's incredible and phenomenal. And there are a lot of babies in this world now that wouldn't be here without IVF. So it's, full respect to the IVF specialists. But yeah, you're exactly right in interpreting that. They're not fertility specialists. They don't, when there is an issue with sperm health, they don't tell you how to improve that. They think there is no way to improve sperm health. They think there is no way to improve egg quality. And that's okay. That's their experience, but it's not mine.
That's it. And, the answer to poor sperm health is, well, we'll just do ICSI. It's like, yeah, well, yes, but are we actually we're then just injecting the egg with crappy sperm? Blows my mind. The other thing you really touched on was the male fertility piece. And it was a podcast I did last year where it was brought to my attention that the WHO moved the statistics for what is normal in a semen analysis because they saw that fertility rates for men were declining rapidly the world over. So instead of perhaps making this more of an issue, they said, well, we'll just change the parameters. So in the 1970s, correct me if I'm wrong, but the average male sperm count was over 100 million per sample. And now the average is 15 million per sample. So if you are 15 million, you are normal, yet 30, 40 years ago, that would have been considered extremely bad. So I find that really quite scary.
Yeah, and there's an extra step to that too. So this is my understanding of it, is when the WHO did decide to change those reference ranges in 2013, what they did is they took the semen analysis from a fertility clinic. Now, that's already number one red flag, because if you're at a fertility clinic, it's very likely that there are fertility issues and also potentially sperm issues, correct? So what then happened is that the good thing they did is they took the average semen analysis parameters of all of the men who had created babies. So that's a good thing. Then they averaged it all out. But what they then did is the reference range that they took to be normal was the first 5% of those parameters. So to make that let's make it really easy. So, say if we're talking about sperm count, just perhaps, this is just theoretical, but if you've got sperm count anywhere between 0 and 100 in these averages, then what they decided would be normal was the first 5%. So that would be 5 million, for example. So what they're actually saying is that with those normal reference ranges on the semen analysis, you have a 5% chance of creating a baby.
Wow.
So that's my biggest problem with it. So when I interpret semen analysis, I look at the 50th percentile. So, what's the likelihood of this sperm creating a baby in 50% of the situation? So at least that's a better place to start, right?
Yeah.
So, and it's very, very unusual that a man's semen would be within those 50th percentile parameters that I'm looking for. Sometimes it is, and that's great, but usually not all of them. So, that's a very different story when I look at men's semen analysis, and some of those parameters didn't even meet that 5%.
It's a worry.
It's a worry. And then they're told like, oh, your semen analysis is fine, but motility is a bit low, but don't worry about it.
Yeah.
Yeah. So I've just seen this recently where a couple I've seen had unexplained infertility. They've done multiple IVF rounds, miscarriages, and she's even gone to do donor eggs, but still with the donor eggs, the sperm they've unfortunately had a miscarriage. In in all of the letters and everything that I've read, the beautiful fertility specialist, by the way, lots of follow-up letters, they said, sperm, the progressive motility, 6%, but, that's nothing to worry about because we're doing ICSI. And again, I just don't think that's the case. I think if we're actually going to be injecting good sperm into an egg, we really do need better quality sperm.
Yeah. Thank you for pointing that out. It's so frustrating, Kathryn. Oh my goodness. Can we talk a little bit about this difference which follows on from the semen analysis, but this idea of normal lab results versus, say, optimal lab results? And I remember being told that my thyroid was fine. And I remember my naturopath saying it's actually not great for fertility, and this could be a reason on its own that you are struggling to conceive. And so why is there such a disconnect, and what should we really be looking for when it comes to those sort of optimal ranges?
Yeah, good question. So thyroid is a perfect example of this to answer this question, but also very similar to those semen analysis results and looking for reference ranges. If you are, it's an average. It's just an average of what is in the lab, So if you've got somebody that comes in, okay, so for context, thyroid TSH is supposed to be anywhere between about 0.5 to 4.5. That's a huge range. It might not sound like much, but when you know about TSH, that's a really big range. So you're also accounting for people who are in this sample who might have had a TSH of 10, which is wildly dysfunctional. So that is all coming into that average to create that reference range within that for that lab. So for me, optimal reference range for thyroid TSH should be between 1 and 2. So the problem is exactly your situation where you go to the doctor, you have your thyroid tested, yep, fine, it's between 0.5 and 4.5, nothing to worry about. However, anything over 2 for me is, suboptimal thyroid function, depending on what the free T3 and free T4 are doing. But in general, if you're outside of that 1 to 2, then it's probably going to be problematic. And chance of miscarriage is elevated. And, all sorts of problems. You can even have suboptimal, you can even have symptoms of thyroid issues above 2, So, to be told, some people really do have those symptoms and they can be told, well, your thyroid's fine. What are you complaining about? It's not your thyroid. Whereas it actually potentially could be. So this is the same for, all of these reference ranges. When I look at liver enzymes, for example, I want the AST and ALT to be under 20, but, the normal range is up to about 38. So, I would not want my liver function to be at 38 and be considered that it's absolutely fine. So, yeah, and hormones as well, day 2 to 3 estrogen, is reportedly okay between 80 and 600 or something, whereas I want it between 120, 180, and that shows the best outcomes, particularly if we're going into an IVF cycle. That actually is what the sort of stringent reference ranges that I'm looking for. So yeah, I've got my reference ranges for every single test. And
there's such a big disconnect there, isn't there?
Huge disconnect. And also somebody is similar to the semen analysis. Somebody might have it might be a range of 1 to 2 and their level might be 0.9 and the doctor will say, oh, don't worry about it. But actually, probably, if it was actually supposed the bottom of the reference range should have been at 1.5, then if it's at 0.9, you're going to have a big problem there. So it's really knowing how to interpret those reference ranges and knowing what is optimal.
So what are some of these deeper tests that practitioners like yourself would do? I remember after I'd been through IVF, should point out, she said to me, we're going to run a few additional tests. And I said, no need. I've done all the tests. Here you go. I have done so many different blood tests, blood draws, etc. from my doctor. It's all here. And she said, no, it's not. And it really blew my mind that there were some really simple tests that she could run that told us a lot more about the whole picture of my fertility. So what are some of those, and why are you going to run them, and why won't your doctor?
Yeah, good question. Great question. So I'm saying good question to everything because you've got such good questions.
You're welcome.
I hear this all the time, the same thing. I'll say, yeah, I think we need to get some more tests done. Oh, there's no possible reason that I could need more tests. I'm like, yeah, I know you've had a million blood draws and particularly doing IVF, you will just feel like a pincushion. But there are always more tests. And, I think, but we also don't want to do testing unnecessarily. So, a big part of when I see a patient is that I'm just not recommending a whole lot of testing. I'm actually, what has been done what's your history? And also, I'll get to this, what's your history? What are the most important tests for you? And also in what order? Like there's so many different tests now that we can do. And we're so lucky with how science has developed to actually give us more testing options. And I don't know which to answer first here, but you ask why, I've got two things. I'm going to answer which tests need to be done, but also why aren't the doctors doing it? So I remember one day when my husband was studying law and a friend was talking about law, and he said, and he's not studying it anymore, partly for this reason. He said, the law is a slow moving beast. And I feel the same about the medical system. I'm actually really lucky as a naturopath because I'm not so...
You're not so bound by all of the rules and regulations. Is that the right word?
Exactly what I'm looking for. I'm bound by so many rules and regulations, but also I think for doctors, it's very easy for them to get a bad reputation. So, when a new test comes out, I go, woohoo, like this is awesome if it's the right test and it's doing something that's making it easier for patients. Like, for example, there is now a test that you can do, a genetic test, a blood test that will test for whether you have a likelihood of endometriosis or not. Like how much better? There's also, another test that, might give us an indication as well. But how much better is that than having to do a laparoscopy? Sure, we treat endo if you've got laparoscopy, but at least we can just get an idea first. So, for example, that's an excellent test in my mind. Will the doctors use it? Probably not, because they need to go through, I go to the FSA, the Fertility Society of Australia conferences, and there's all this debate about these fringe kind of medical tests. Are they good? And then people who put their hand up and say that they're great, they get slammed. So, there are doctors, there are fertility specialists out there who are sort of known to be like, a bit fringy, who might actually take on some of these ideas and look at some of these test results, but then they don't necessarily have a good reputation within the medical system. So they have to be really careful, and I feel really sorry for them because of that. And, they need 1,000, double-blind clinical studies to make sure that, that they're going to implement these tests into their practice. Whereas for us, we're like, okay, does it work? Yes, it does. Let's do it. So I feel very privileged that I'm not a doctor, to be honest, because I'm not so bound by these rules and regulations. Yeah. So I think that's one thing. They are also, they're also scrutinized by Medicare. So if they do too many tests and they seem like they're unnecessary, they can lose their license. That's hard.
That's pretty scary.
Scary.
Yeah. And it makes sense.
Yeah. So I think that's, in answer to your question, I think that's partly why I also think maybe they're too busy. I think the time that you have with them is so minimal. And, I spend an hour at least with my patients with a new consult, and then an hour follow-ups as well, because sometimes I don't come to the best idea possible or the best perspective possible until an hour into our call, because we have to go through all of the scenarios. We have to look at all of the history. We have to take into considerations people's mental health, their emotional status, their diet, their lifestyle. We have to take into all of their fertility history, family history. We have to take into consideration so many things before we make a decision to actually test something, or whether something else is better to be tested first. Sometimes I think, oh gosh, imagine if somebody got hold of my list of tests that I recommend people do. That would be a nightmare, because they would then go off and do all of them. It would cost them tens of thousands of dollars perhaps, and then be completely overwhelmed and confused by the results, or they would interpret the results incorrectly. So, there is a lot that can be done, but you can't do it all. And, working out what is the most necessary can be really tricky. And sometimes, honestly, I can spend sometimes an hour after my patients' calls going through with a fine-tooth comb all of the test results and how do they relate to each other? What is their IVF history? What happened in that IVF cycle? Why did that happen? How does that relate to that miscarriage? It's a massive puzzle that we're working on. So when doctors, you're having 5-10 minutes with their patients, of course, they will miss things. And, I don't know, like maybe it's easier for them to say, sorry, I can't help you, than like, hey, why don't we run this test? And why don't we run this test? And, look at all these underlying factors. I don't know. I honestly don't know, because I haven't been in that situation. I'm not a doctor, so I don't know what their thinking is. But, when I do see patients come to me who have unexplained infertility after IVF failure or miscarriages, and these tests haven't been done, I just think, how on earth is this even labelled as unexplained infertility? This is
Gosh. So what are some of the reasons that you have found for people? Maybe you want to give us some examples, or just generally these things that you have found that are like clear indicators that is a reason they're struggling to conceive, that have been labelled as unexplained.
Yeah, perfect. So one, semen analysis for sure. One, where it hasn't been interpreted correctly. One, it hasn't been looked for optimal levels. And also a lack of DNA fragmentation test. So a semen analysis can look perfectly fine. And if the DNA have DNA, then we're not even going to think about DNA fragmentation, because clearly the man's not a problem. That can certainly be an issue. I've had a man semen analysis that actually was not even normal. It was optimal. And then he had DNA fragmentation of like 33. So that was completely unexpected by everybody else but me. Because it can absolutely be a factor. The other thing too, like there's more to it with sperm. There's also, is there infection in the sperm? There's a whole lot of other things that can impact the sperm health, and they need to be investigated. Two, genetic mismatches either between the parents or the mother and the fetus. That's a big one. Carrier screening. A lot of the times I see patients, who've done multiple failed IVF and they haven't had a carrier screening done. So, do they both have a recessive genetic issue? That is, then when they come together, they are not creating chromosomally normal embryos. That's certainly, there is a million, Jen. I mean, there's autoimmune issues, there's alloimmune issues, there are hormonal issues, there's polycystic ovarian syndrome, there's endometriosis. Endometriosis, a good example, I just had a patient this morning who she just did one of these genetic tests for endo. It's come up that she's got a high likelihood of endometriosis. She has absolutely no period pain. She has no spotting before her period. She has absolutely no indication that she has endometriosis. So this has to be looked at. Adenomyosis is so unexplored, so common and very likely when you're looking at endometriosis. Clotting factors, absolutely. And occasionally, sometimes I will see clotting factors have been done, but not extensively enough.
And are there ways to treat all of these things? Obviously, with the cases of endo, you would obviously have to undergo laparoscopy or surgery. But generally, with all of these things like the carrier screening and the autoimmune issues, are there ways we can try, and the DNA fragmentation?
Yeah, in my perspective, yes. We can't give 100% for everybody's situation. Absolutely not. Have I seen DNA fragmentation decrease, substantially? Yes. And babies being born to men who previously had DNA fragmentation issues? Absolutely. Yeah, there are pharmaceuticals that can help with all of these things. There are, procedures that can be done to support a woman's immune system. Is there, genetic incompatibility? For sure. There are, the pharmaceuticals, there are nutritional supplements, there are herbal supplements that can deal with all of these things, varicoceles in men, that's another one. Yeah, for almost everything, there are treatments. However, things like, in a situation where there is a genetic carrier screening that is, where two people have a similar genetic issue, then, you would need to do something like IVF with PGD testing. So there are certain situations where IVF is absolutely essential for some couples.
Absolutely. And I think that's the important point as well, isn't it? That obviously a lot of these are medical conditions and treatments like IVF are necessary to overcome them. And like you said before, we are so lucky that we have these incredible sciences available to. It blows my mind that they create babies in a lab. Like, it's amazing. Incredible. But you're right. It is also about optimizing all of the parties before you get to IVF as well, which I think is a big thing that gets missed. So
yeah,
one thing that I find working with women who have been given the unexplained diagnosis is this gosh, there's this horrible feeling of just self-blame, and they feel so ashamed that their body just doesn't work and they're not getting to where they want to be. It must be them. And I think that all of this that we're speaking about today is such a wonderful way to reframe it. And it's a really empowering thing as well to be able to say, no, your body is fine. It just needs a little bit of help, and we need to find the way to help your body. Do you find that is often the case with some of the people you work with?
Oh, absolutely. And it was yesterday that I was with a patient, and she said, "Oh, thank goodness you are like telling me what to do." He said, "I'm just, searching for answers and doing all these things that I think I should do. And I'm just wasting all this time researching. And, oh my gosh, it's so good to have someone listening to me and actually telling me what to do." And yeah, exactly what you say, that they're like, oh, wow. So there could be other reasons that we're not conceiving, not just that I am broken and not just that I have failed and that my body doesn't work. When people get that glimpse of there is other things I can do and somebody else is taking the reins for me and they are, looking at my whole situation, not just different things in isolation, but also bringing it together, or not just saying, nothing's possible. Well, yeah, it's your equality. That's why, and there's nothing you can do about it. Like, that must just be the most horrible thing to be told, after spending thousands of dollars on IVF. Oh, it didn't work, but yeah, you've got poor equality and there's nothing we can do. That's so mentally and emotionally damaging for a woman. I just think it's very, very hard for those people to be in that situation. And my heart absolutely bleeds for people who are in that situation. And then what do you do after that? You're told that there's nothing you can do, or you're told that donor eggs is your only option. And, that's, I have nothing against donor eggs at all. And I think if people are open to it, sometimes it is a better option than going through multiple IVF rounds and spending heaps of money and having all the failure and the drugs. Donor eggs can be a fantastic solution, but some people are not into that, or they're not there yet. So, if you've been told that it's your eggs and they're too old, which is, and, I could go on about this. I feel like I go on about this a lot, but there are so many situations where women have been told that equality is a problem when it actually is not.
Mm.
It's the sperm, or it's the combination, or something else.
Well, that is definitely a conversation for another episode. The equality debate is a very big one. So thank you. Mm. And Kathryn, I know this month you have a free workshop coming up that really helps people to dive into some of these unexplained infertility diagnoses in a little bit more detail. Can you tell us more about that?
Yeah, sure. So I created this workshop. It's called Why Am I Not Pregnant Yet? Pinpoint and Treat Your Underlying Issues. So the reason I created this is for all of you who are just like, what is going on? You've been told probably so much misinformation. You've read so much misinformation. There are a whole lot of things you don't know about yet, or you might know about them. You might sort of little bit know about them. So I wanted to create a workshop that I've got a workbook comes with it, where you can we go through all of the symptoms that could relate to these underlying problems. So these symptoms give us information about whether this could be a problem for you or not. And so you get a workbook and then a checklist, and you can actually look at all of the different factors that could be underlying issues and see whether, yes, they could very well be an issue for me. No, they're definitely not an issue for me, or I'm not sure. So, that is I love this workshop. It makes me very excited. And after it, people are always like, wow, I've never seen anything so in depth as this. People say I've watched lots of fertility workshops and webinars and things like that. But really the feedback is that people have never been given so much information that is, and I don't make it overwhelming either, I hope, because, overwhelm is not good for anybody, but just really clearly, these are the issues that happen, and this is how to identify whether it could be an issue for you.
Fantastic.
So you can register online, and then we go live, and you can also ask me your questions online when we're live as well.
Thank you. Yes, you run all the workshop is always live, so you're there to answer anyone's questions as we go.
Yeah, definitely.
Fantastic. Thank you. And if people have general questions about you or the work that you do, where is the best place to get in contact?
Yeah, you can email me. My email address is Kathryn, Kathryn, @fertilityandbeyond.co. So you're more than welcome just to email. I'm also really happy to do a 15-minute call with you and just answer your questions, see, what I think could be going on for you. We can decide how we want to work together if you would like to. So, these 15-minute calls are really good for just me to understand your situation. Of course, it's only 15 minutes, sometimes half an hour. But we really go into, what's going on for you and what I think could be helpful for you.
Wonderful. Thank you so much for that and for everything that you have shared today. I think that people will get a lot out of this. And yes, this idea of unexplained versus unexplored is a very, very big thing to consider. So thank you again for being here, Kathryn.
You're welcome, Jen. Thanks for having me.
I love how much detail Kathryn goes into with everything that she is clearly so passionate about. And I feel like this episode could have gone on for a lot longer than it did. But if you want to learn more about Kathryn and her work, then I highly encourage you to join her free workshop this week, Why Am I Not Already Pregnant Yet? There is a link down in the show notes that you can click on, access the registration page for. You can get signed up for that. And anyone who can't attend live, there will be replays sent out to everyone who does register. So if you have any questions, any feedback, any comments about the episode, please reach out and let me know. I always love hearing your feedback, and it would mean the world to me if you could subscribe to the channel if you're watching this on YouTube, or click follow on your podcast provider. And if you have 30 seconds to leave a quick written review, that is the absolute best way for us to get the podcast out to as many people as possible. So thank you so much for joining me. I am going to be sharing next week how to work through this emotional roller coaster of trying to conceive, how you can best navigate the emotions and the absolute highs and the crushing lows of this journey. So I can't wait to have you back for that episode next week. But until then, I'm sending you all my wishes as you continue your own journey to fertility. The most common thing I hear from students who are on their fertility journey is that the stress of trying to conceive has taken over their life. Your days end up being filled with endless appointments, navigating pregnancy announcements. You're trying to eat right, take all your supplements, and it is all you think about from the moment you wake up. I designed the Element Fertility Yoga course to support your body, your mind, and your mental health in 3 important ways: to synchronize your hormones, increase circulation and blood flow, and to help regulate your nervous system. But on top of this, the greatest gift that you can give yourself throughout this journey is a sense of peace, to help you calm your mind and just make this process feel easier. Every single one of my students tell me that this is the first thing they notice after starting a yoga, meditation, and breathwork practice. But on top of this, you have the amazing benefit of actually supporting and increasing your fertility. Studies have shown that those participating in mind-body programs as they're trying to conceive have success rates 3 times greater than those who don't. The course I've designed walks you through natural conception as well as fertility treatments and IVF cycles. And the best part is you can work through it at your own pace in the comfort of your home. The practices start from just 10 minutes per day. To learn more, visit elementpilatesyoga.com or see the link in the show notes.